You have navigated months of daily injections, the physical intensity of egg retrieval, and the window of time required for your embryos to develop. Transfer day is the culmination of this entire process, a moment often defined by a spike in anxiety and the feeling that control has been lost. However, the next 15 days are not a passive period of waiting, but a specific, controllable protocol you must execute. This protocol consists of two distinct phases: the mechanical transfer in the clinic, and a 15-day home survival guide. Successfully navigating this window requires shifting from emotional reaction to methodical compliance. Preparation begins 2 to 3 hours before the procedure, with the requirement to consume exactly 3 liters of water. As shown, the transfer is not surgical. It relies on ultrasound visibility. The expanding bladder acts as an acoustic window, physically pushing down on the uterus. This straightens the natural bend between the cervix and uterus, creating a direct path for the catheter. You do not need to fast before this procedure. Because no anesthesia is used, an empty stomach only adds unnecessary physical stress to your system. Transfer preparation focuses on optimizing your internal anatomy, making traditional surgical restrictions like fasting unnecessary. Once the procedure begins, you will be placed in position and the doctor will use a standard steel speculum to visualize the cervix. The cervix is then thoroughly cleaned using only normal saline. The use of chemicals like betadine is avoided, as these can be toxic to the embryo. The embryologist then prepares the embryo transfer catheter. This is a soft, ultra-thin delivery tube designed to transport the embryo safely into the uterine cavity. Using ultrasound guidance, the doctor navigates the catheter through the cervix to the drop zone. The target is 1.5 centimeters below the fundus, the curved top of the uterus. At this depth, the embryologist releases the payload. This is a painless, visually guided procedure that is entirely different from an invasive surgical operation. Following the transfer, you will remain lying flat for 15 minutes. Afterward, you will use the restroom and remain under observation at the hospital for 4 hours. Upon returning home, you must immediately begin your pharmaceutical routine, which typically includes progesterone, ecosprin, and heparin to support implantation. A common error is the decision to go on strict bed rest for 2 weeks out of fear that the embryo will be displaced. Remaining motionless reduces circulation. Engaging in light, normal daily activity and office work promotes the blood flow necessary for the embryo to successfully implant. Bed rest can be counterproductive to the process. Light, gentle motion is the most effective way to support implantation. During the next 2 weeks, you may experience symptoms that cause concern, specifically mild cramping and very light spotting. These symptoms are often signs of implantation bleeding, which occurs when the embryo attaches to the uterine lining. This is documented in approximately 42% of successful IVF cases. You should also expect symptoms like breast tenderness or nausea. These are side effects of your progesterone medication, rather than immediate indicators of pregnancy. For the duration of this 15-day window, do not use home urine pregnancy tests. They only detect chemical noise from your medications. This results in false readings. During this phase, patience is the only valid diagnostic tool. The medical verification of the transfer success occurs on day 15 with a beta-HCG blood test. Beta-HCG is the specific hormone produced by the placenta that serves as the clinical measure of pregnancy. While the 2-week wait is stressful, everyday anxiety does not affect your results. The physical protocol you are following dictates the outcome. To maintain the protocol, stay hydrated before the transfer, avoid bed rest, follow your medication schedule precisely, and skip home test kits. Approaching the 15-day mark with this level of compliance provides the best possible environment for success. Share this guide with others who are currently navigating their own IVF journey.